Several sectors continue to call for reconsideration of a decision to withdraw funding for critical programs through USAID by United States President Donald Trump. Youth in Uasin Gishu now say the funds are critical for HIV/AIDS programs, which will suffer upon the withdrawal of financing. Steve Carter has more.
Coordinated approach, please.
At the Ziwa Technical Training Institute in Uasin Gishu County, a group of youth is engaged on a campaign to sensitize their peers on the HIV prevention measures.
I've learned about the medication, prevention. At least we have been given the test kits.
Here, a passionate appeal was made to US President Trump to reconsider his decision to cut funding to USAID, which has been providing critical medical support to those affected by HIV across the world, Kenya included.
Putting bans on very critical drug supplies like HIV drugs, it's a very big shock to the youths of the globe, because these drugs have been able to sustain a lot of lives since the coming in of HIV/AIDS around the world.
The youth have emphasized on self-testing as a way to determine one's HIV status and management of the disease. Self-testing, it turns out, is preferred by most youth who may fear walking into medical facilities.
So the kit is good for private use, and you have for your result in confidential places. So you should not worry, and once you get your result, if it is positive, you face the nearest clinic, inform the officer in charge, and then the officer will take more tests for confirmation, and now from there you'll be guided on the step forward.
The learners have hailed the initiative and called for more of such in high learning institutions to avert the spread of the virus.
We all know Valentine's is around the corner. Some of our students have been tested. Almost quite a number of students have been tested. And that's quite good for the institution and also for our youths and the trainees in the school.
More than 1.3 million Kenyans currently live with HIV/AIDS. Data from the Ministry of Health indicate that 41% of the new HIV infections occur among the adolescents and young people aged between 15 to 25 years. Steve Carter, NTV.